Welcome back to my channel. So I'm trying to be more consistent with videos. I know it's coming up to finals, and this was a very difficult time for me when I was in finals. So I thought this would be the best time to make some more videos and also make a lot more shorts for my Dr. Prepper TikTok and also just for this YouTube channel. So today, this is something that I did when I was trying to get in a bit more practice for OSCEs, and like my friends were busy or it was late at night and it was a weird time. It was by using ChatGPT. So today I will show you guys how I did that, what sort of things that I would use for the prompts, etc. And then hopefully we'll do one case and you guys can see how it goes. In order to do this, the first thing they need to do is have a really good prompt. So I'll show you what prompts I use. This is on my iPad right now. So this is sort of like a prompt I'll use. I've just pasted it in there, and I'll also add in some more documents as well, maybe past OSCE stations if you have that, or if you can guess them. I'm not going to upload this here for obvious reasons, or anything else that you feel could be useful for you. Oh, I have lots of notifications coming through. Let me turn this off because this should not be coming up on my channel. Anyway, this is the sort of the prompt that we would get. So I would upload this here, and then we would sort of wait for this to upload, and then we would just get started with the station. So here's the station title. So we have a UKMLA final year OSCE station, 13 minutes, history, presentation, management plan. Again, I haven't done an OSCE station probably since by the grace of God I passed my OSCE retake last summer. Of course, I've still been clerking patients. I'm still on that F1 doctor. I've had clerking shifts. I've worked in surgery, lower GI. Right now, I'm working in endocrinology / general medicine. But still, it's not the same thing as doing proper OSCE practice where you're timed. 7 minutes of a history, 8 minutes after. But we'll try our best to see what we can do. I'll just wait for this thing to finish, then I'll click this little white icon, and then let's get started. Wait for this thing to load. Hello, so I've just uploaded the case that I want to go through. I want to be the doctor, I want you to be the examiner as well as the patient, and also keep time.
I'm all in. I'll juggle examiner, patient, and timekeeper hats. You, my friend, are the doctor. Once you tell me when you're starting, I'll run the clock, get into character, and we'll see how your history taking skills shape up. Ready when you are.
Okay, I'll also set the timer as well. So let's get started. I'm ready to go now.
Perfect. Timer is on. You can start whenever, and I'm here as Mrs. Collins. I'll respond naturally as the patient, and I'll give you a subtle heads up when we hit that 11-minute mark for your presentation. Go for it.
Hello, nice to meet you, Mrs. Collins. I'm Charles. I'm one of the doctors that's working here today. Is it okay if I can call you Mrs. Collins?
Oh, yes, of course, doctor. You can call me Mrs. Collins. What's all this about then?
Okay, so I've just been asked to speak with you today. I understand that you've come in with some weird symptoms. I forgot what it was. But can you tell me a bit more about what brings you in here today?
Well, she says I've been muddled the last couple of days, though honestly I feel mostly fine.
Okay, well, ma'am, thank you so much for what you've told me so far. Can you tell me as much of what this means by feeling muddled as you can?
It's a bit like I get confused. Sometimes I forget what I'm doing, especially in the evenings.
Okay, and how long has this been going on for?
Oh, it only started a couple of days ago. Really out of the blue.
Okay, have you ever experienced this before?
No, nothing quite like this before.
Okay.
Usually I'm sharp as a tack.
Okay, so you say that you felt muddled. When you say muddled, what does this mean to you?
It's like I'm mixing things up. I tried using the TV remote as a phone the other day.
TV remote, okay. Anything else?
Well, at night I've been seeing shadows or things moving that aren't really there. It's a bit unsettling.
Of course, I see how that can be quite scary. Hopefully we'll do our very best to try and help you here today. Okay?
Thank you, doctor. I'd really appreciate that.
Okay.
What do you need to know next?
Okay, so you said that at night you also feel like you see shadows that are a bit scary, and also during the day you feel a bit muddled. Anything else that you've been experiencing?
Well, I haven't been sleeping well, and to be honest, I've not had much of an appetite. But that's about it, really.
Okay. And in regards to sleeping, can you tell me a bit more about that?
I've just been tossing and turning, not able to settle, especially with these odd thoughts popping up.
Of course. How many hours do you think you're sleeping?
Oh, maybe only 3 or 4 hours a night? Not nearly enough for me.
Okay. And you've mentioned that you've had problems sleeping. What was the other thing that you mentioned?
I've not been eating much.
Okay.
I just don't feel hungry.
Like how many meals would you normally eat, and how many meals are you having now?
Normally, I'd have 3 meals a day. Lately, it's been more like one, if that.
Okay. Any particular reason?
I'm not sure. I just don't really feel like eating. No
Okay.
real appetite.
And how long have you felt these symptoms of sleep and lack of appetite for?
It's been the same couple of days
Same
since
couple.
this.
Okay, so this has all been the same couple of days. Okay, thank you so much for what you've told me. Just ask you a few more questions. Anything that brings on these symptoms, or like any triggers?
No, nothing that I can think of. It
Okay.
just seemed to come out of nowhere.
Anything that makes these symptoms better or worse?
I think it feels worse in the evenings, but I can't say I've found anything that makes it better yet.
Okay. Then just now to ask you a few questions, just to screen out some other things, just a full review from head to toe, and you can just say yes or no for me. Any headaches?
No, I haven't had any headaches at all.
Okay. Any loss of consciousness?
No, I haven't blacked out or anything like that.
Okay. Any fever?
I've felt a bit hot, but I'm not sure if that's a proper fever.
Okay. Okay, thank you. Any sort of loss of sensation to your face, like your body parts,
No, I haven't noticed
okay,
anything like that.
or loss
Everything.
or loss in power.
No, I haven't felt weak. I
Okay.
can still move as usual.
Okay. Any changes to your heart rate?
I haven't noticed any changes.
Okay.
It feels normal to me.
Any changes to your breathing?
No, my breathing's been fine.
Okay.
No issues there.
Any changes to your bowel habits?
No, my bowels have been regular, same as usual.
Okay. Any changes to your waterworks?
Actually, yes. It's been stinging when I pass urine lately.
Okay. And how long has that been going on for?
It started around the same time as the confusion, about 2 days ago.
About 2 days ago. Okay. And do you have like an increased like need to go and urinate as well?
Yes, actually. I've been needing to go more often than usual.
You need to go more often than usual. Okay. Well, man, thank you so much for what you've told me. I believe I have a nice idea. Can you tell me a bit more about what you think may be going on?
Well, I honestly don't know. I'm worried it could be something serious, like what my mom had, dementia.
Okay. And what makes you think that?
Well, my mother got confused in her older age, so I worry I might be going down that same path.
Okay. I mean, that definitely can also be quite worrying. But let's not go there yet. There's still a lot more tests and questions that I have to ask you. Okay.
I understand, Doctor.
Okay.
I'm just hoping you'll figure out what's actually going on.
Of course, I'll do my very best. Anything else that you're worried about or you'd be expecting here today?
Honestly, I'd just like to know if I can get better, and if I'll be able to go back home soon.
Of course, I'll definitely do my best to figure out what's going on and to see what we can do to help you. A few more questions I forgot to ask earlier. Have you had any unplanned changes in weight loss
No,
or in
I
weight?
haven't noticed.
Okay, that's good. Any changes in terms of discomfort with like cold or heat? Like you're a lot more cold or you're a lot more hot?
No, I've not felt anything unusual like that.
Okay.
I've been pretty normal with temperature.
And just to move into a bit of your history, anything that you're diagnosed with or you see your GP for?
Yes, I have hypertension, type 2 diabetes, and osteoarthritis.
Okay. Um, and any previous surgeries?
No, I've never had any surgeries before.
Okay. To move on to your drug history, anything that you're prescribed or you take over the counter?
Yes, I'm on ramipril, metformin, and amlodipine, and I recently started taking codeine for knee pain about a week ago.
Okay. And do you take those medications regularly?
Yes, I take them every day as prescribed.
Okay. And to move on to your family history, any family history of any similar symptoms? You've mentioned dementia on your mom's side.
Yes, my mother did have dementia in her later years.
Okay. And let's move on to any allergies.
No, I don't have any known allergies.
Okay. In terms of life at home, who's at home with you?
I actually live on my own, but my daughter visits me twice a week.
Okay. And how are you with your activities of day-to-day living, like cooking, cleaning?
I'm fully independent, really. I manage my cooking, cleaning, and everything myself.
That's good to hear. And just some more questions to ask everyone. Any history of smoking?
No, I've never smoked in my life.
Any history of drinking?
No, I don't drink alcohol. Not at all.
And any history of recreational drugs?
No, I've never used any recreational drugs.
Okay. Well, ma'am, thank you so much for what you've told me. I'll now go and feed this back, and then we'll come back to you and let you know what's going on. Okay?
Thank you, doctor. I really appreciate it. I'll be here waiting.
Okay. So now I want you to be the examiner while I give you my differentials, investigations, and management plan.
Absolutely. I'm switching hats to examiner mode. I'm ready to hear your differentials, investigations, and plan. Give me your best shot.
Yes, of course. So, today I've had the pleasure of speaking with Mrs. Collins, who is I'm not too sure her age, a 78-year-old woman that has come in with a 5-day history of seeing things at nights, of worsening of her sleep, a 2-day history of what seems to be dysuria, which occurs frequently, and also a feeling of tiredness and not really remembering things that she normally does. Going through the history, there's been no fever, no unplanned weight loss, no changes in bowel habits, no loss of consciousness. So to move on to what I think is going on, my top differential would be delirium, which is secondary to UTI. Another thing that I would think is maybe some form of fever, which would be third, or some form of infection. My second one would be dementia, but of course, with the time course, I'm thinking that's a lot less likely. I'm thinking this is most likely delirium secondary to a UTI. In terms of what I'd like to do first, I firstly like to do a full head to toe examination of this patient, A to E. I'd like to do a urine dipstick. I'd like to get some baseline bloods like FBCs to look for anemia, raised white cell counts, to look for infection, CRP to look for signs of infection. I'd like to do some thyroid function tests as well. I don't think it's hypothyroidism, but I'd still just like to be sure that there's nothing going on there. I'd like to do a full delirium screen as well, so looking at things like for like dehydration, of course FBCs, using a CRP. I'd like to assess her fluid balance, and then to manage this, I'd also like to explain to her what I think is going on, and start her on some antibiotics, which would most likely be something like nitrofurantoin or trimethoprim. But I would prescribe those drugs based on the antibiotic guidelines for the hospital that I am in. The long-term plan, I would counsel her on on what is the most likely cause of her UTI, which would be most likely her type 2 diabetes. That increases the risk of her getting a UTI, and also safety-nets her to come back into her hospital, or it's most likely just to go to her GP if she has similar symptoms, or if she experiences these symptoms like forgetfulness or loss of consciousness, just to counsel her on like not driving, and to do some more formal investigations into dementia if I thought that is what was going on.
Thank you for your summary as your examiner. I appreciate the structure. I'd note you should clarify the timeline. It was 2 days, not 5. Your differentials are spot on for a sudden onset confusion. Your investigations and management plan align well with guidelines, though always ensure you're tailoring antibiotic choice to local policy. In short, you did a thorough job.
Okay, give me a thorough breakdown of each section: summary, differentials, investigations, and management in line with UKMLA guidelines.
Absolutely. In summary, you got the key details, though you want to be precise, like that timeline discrepancy. For differentials, delirium from UTI was bang on. Dementia as secondary, good, but emphasize acute versus chronic onset. Investigations were well chosen. Add your analysis culture explicitly. Management, you nailed the core: fluids, antibiotics, delirium care. Just ensure you mention reorientation strategies and think about a senior review for escalation. Overall, you're right on track.
Thank you so much.
You're absolutely welcome. You took that on like a pro. If you ever want to run another station, or just need a break from them, I'm here for both.
And guys, that is the end of this station. 14 minutes, 34 seconds. My timer did not go off. I had 51 seconds left, which is now counting down. Hope you guys enjoyed this station. This is something that I think is very, very good, as long as you keep the timing yourself. The mark scheme was on a store as what I'm used to. Well, the way to remedy that is just by uploading your own mark scheme. The more information that you feed into this, and the more of your guidelines, your mark schemes, the better quality that you will get for these stations. So hope this makes sense, guys. If it did, please leave a like, subscribe. Let me know what sort of videos that you'd like to see in the lead up to UKMLA, PSA, OSCEs. And also check out Dr. Prepper to practice your differentials, your investigations, and your management plan. Because even still, see, like I missed some stuff here as well, like reorientation strategies, delirium care, and escalating to senior. In hindsight, I didn't really say escalating to senior because I felt like I could handle this myself, but it's still good, especially during F1, to make sure that your senior is aware. There goes my timer there. So hope you guys enjoyed this video. If you did, please let me know, leave a like, and I'll see you in the next video. Goodbye.